So today I want to welcome Tina Franco to Beyond the Adjustment podcast. Tina is with Vitalive here in Dickson, and we've kind of known each other for some time, and we go back a little ways. But again, as you know, we've kind of discussed, Tina, that this podcast is about how do we create more conversations around what I call that jigsaw puzzle called health. Mm-hmm. And so that's my purpose. We've been bringing all these different avenues, pieces of the puzzle, so to speak, related to health. So I guess a couple things we want. Just tell us a little bit about your journey, because everyone has a journey as they go through this process, and then kind of tell us a little bit about what you do, where you are right now, and then we'll go from there.
All right. Well, I've personally been in healthcare for about 25 years now. It's been entirely too long. I've seen a lot of things.
It goes fast, though, doesn't it?
It goes fast. Oh, my gosh. I actually was thinking about it today when I was driving over here, and I'm counting on my fingers. How long have I been doing this? Because it really does. It goes by fast. But I started off my career as an RN, critical care, ICU, ER, flight nursing. Did that for so many years, and then I realized I was getting too old for the adrenaline rush. Too old for the adrenaline rush. And I started really taking a step back and looking at the patients I was dealing with. I would have these patients come into the ER that had all these comorbidities that were really, really, really sick, and it's like they had no clue how to get themselves better. They're waiting for the doctor to give them the next pill, the next prescription, the next test, the next whatever. And they're looking at pharmaceuticals and these physicians, and it's nothing against physicians, but they're looking at them to give them answers. Why have I got type 2 diabetes? Why am I morbidly obese? Why do I have congestive heart failure? All of these things. And I realized we weren't doing the patients a service. We weren't educating them.
Right, and I think that is part of the whole problem, or part of the problem is, people taking responsibility
That's
for their
exactly
health.
it right there.
But I also believe that part of being doctor is teacher. And like I said, the medical profession as a whole, now they're getting better. I will tell you, I've seen this change. I've got you beat by 10 years in healthcare. I'm approaching 34, 35, somewhere in there.
You're dating yourself now.
And like I said, that's kind of been the MO, is like they step in and they're great for acute care. But as I said, I'm not against drugs. I'm not against surgery. However, I'm against unnecessary drugs, unnecessary surgeries when there's an answer.
Well, there is, and I hope this is common knowledge, but there is no synthetic processed pharmaceutical that does not cause some sort of deficiency in your body or some sort of side effect. Right. There isn't. Yeah, there absolutely isn't.
Well, that is what a chemical does. This chemical is not natural. And again, medications either speed up or slow down. That's the only actions of medication.
Absolutely.
And if you're forcing the body to speed up when it goes against the grain of what the body's trying to attempt to do. Right. And that's why, again, it's kind of interesting, because you're not the first medical person who has come in and kind of what I call see the light. We have always been down that realm.
We've come into the light.
We have always been in that realm about, listen, you need to take responsibility for your health. Health is yours by design. Correct. It's a God-given, I believe, right to be healthy.
Right. Exactly. And God created our bodies to heal themselves with the tools that He provided us.
Right. We just have to remove the interference. That's
Correct.
The famous line in chiropractic.
Yeah. Remove the interference, remove the middleman, remove all that noise.
Yeah. Well, the interference comes from toxicities. It comes from deficiencies. Again, if you don't exercise and you smoke and you're 100 pounds overweight, why would you not expect to have heart disease?
Correct.
But I just feel like I'm encouraged to see more medical people bringing that reality to their clients, their patients, to let them know, say, hey, I can get you through temporarily, but if you want a long term, you got to start taking some different actions.
And I would add one more to the toxicities and the deficiencies, but sensitivities also. I would add that to it also. Those are the three pillars that I use when I try to educate my patients. There's three things that are causing your issues: toxicities, deficiencies, or sensitivities.
Yeah, very good.
Yeah.
So tell us a little bit about your business. I know you're with Vitalive here. I know your back history. I know you started off with like IV vitamins and things like that, which again is more health promotional, people who have gut issues. That's sometimes a better way to get their nutrition. But how is that all morphed into? And tell us a little bit about
What
your
I'm doing
business
now.
approach now.
Excuse me. So what I'm doing now is what's called direct primary care. Okay, I provide primary care for patients with a business model that it's cash only. We don't do insurance, and the reason we don't do insurance is because insurance dictates how we treat our patients and what we need to do. And I'm like, that's ridiculous.
Oh, come on, insurance is so easy.
I mean, it's ridiculous to have somebody that has very minimal medical knowledge, has never laid eyes on the patient, dictate what test I'm supposed to run when, okay, no, you can't do a CT until you do an X-ray. Well, you're not going to see what you need to see on an X-ray. I mean, just those kind of examples.
Yep.
And the reason I chose this model primarily is because I wanted to develop a relationship with my patients. I wanted medicine to be the way my great-great-grandmother talked about it. When the doctor, you had a personal relationship with the doctor. The doctor knew your whole life history. They sometimes they came to your house, which is an option that might be on the table for me too. I don't know.
Right.
But I want to develop a relationship with my patients and teach them how they can live their best life. So that's what I do right now. We have a business model where it's a monthly membership program.
Oh, nice. I was going to ask how you did that.
So, I mean, it's very cost effective, $69 a month, which is nothing. It's less than the normal or deductible or copay or whatever you want to call it. You get unlimited visits. You get your annual labs, and then you get whatever additional lab work at wholesale prices at my cost. So that means that you have access to me same day, next day. I never take any more patients than I can handle.
That's awesome.
Because I don't have to have 100 patients a day just to pay the bills.
Sure. Yeah.
And
I've seen this model. This model started, quite a few years ago, where it seemed like it's come full circle, where everything went to HMOs and all this.
Right.
And now it's circling back to, I see medical doctors doing this.
Yes.
You
Not
see
as many.
You see a lot of early retirements, and they go back into more of what they call the concierge style of medicine, which is what I picture.
Right. Well,
yours
it's not quite the concierge because there's some reason with it. There is some additional fees if there's after hours, but I'd much rather have you pay an after hour fee than go to the ER when I could have saved you an ER visit, and things like that. So it helps healthcare all the way around because it takes the pressure off the urgent cares, which are now completely inundated with patients. I mean, not to name any names, but, when you're supposed to be getting in and out quickly and you're still sitting in the lobby for 4 hours, I mean, it's just ridiculous.
Well, they're all overrun because, again, from what I see in my perspective, there's less insurance coverage for services. If they do have insurance coverage, it's catastrophic. So I've seen $5,000 and $7,000 deductibles. I'm sure you see. Well, you don't know because you don't have insurance. Trust me, there's high deductibles.
No, I know this.
And again, those facilities serve a purpose, but like you said, they become so overrun because of the way the whole model is switching around, and which again, that's what changes with your model. You kind of fit into and adapt to what's happening.
Correct.
And I love that.
Yeah, correct. So it's a slow build, but we're getting there. The word's getting out there, and I'm excited about it because my past experience has been knowing patients for a couple hours. In the ER mindset, you treat them, or you treat them and you get them upstairs.
Right.
So you never get to know the history. You never get to know their life. You never get to find out the details. And healthcare and treating a person is more about just treating their body. It's totally treating their mind, their soul, their spirituality, whatever it is. And healthcare needs to be whole body care, not just sick care. In our system right now, it's just sick care.
Correct. It's sick care, and which again, I love the model of they should be held for emergencies because I always joke, if I get hit by a bus, don't take me to the chiropractor, don't take me to you, take me to the ER, get me fixed up where I'm stable, and now I can begin that process of recovery. We know that medications do not speed up that recovery. I'm not against pain medication. There is a point in time for pain medications. However, they're given out like candy, and you look at what happened with the opioid crisis. We're still feeling the effects of that.
Unfortunately,
and yet those people who caused or created all that have basically walked away scot-free. So go into a little bit more with your business, what do you do as far as, are you strictly medical only, or do you have still dealing with the IV vitamins, or what is
yes. Yeah. So we do all of that. I still do the IV hydration. It's not as it was originally, kind of based on the cookie cutter thing. You can go into all these kind of different IV therapy businesses, especially downtown Nashville and things like that. You can look at a menu and pick what you want.
Right.
I have that still, but I want to specifically gear my treatments to patients that have GI issues and absorption issues and things like that, which is a majority of the population, as you had said earlier. Being a nurse practitioner, I can diagnose and prescribe under the guidance of my supervising physician, who I'm very blessed to have finally found one that has a functional mindset also. So that's a good thing. But I can pinpoint IV therapy treatment to your specific deficiencies. So we have a whole bunch of different options as far as testing and things like that between lab work. We do some deep dive functional medicine testing also, if that is something that the patient is interested in or needs. So we can really fine tune and individualize the patient's treatment.
So in addition to your medical credentials, you also have the functional medicine.
Yes.
Tell us a little bit more about that, because you hear it's starting to become kind of a key word nowadays.
It is.
So tell us a little bit about, what does that mean to you with a functional medicine?
Okay, so functional medicine is, and my certification is geared to finding the root cause of a condition. So again, we go back to the three pillars that we had just talked about: toxicities, deficiencies, and sensitivities. And we deep dive into conditions, say for instance, thyroid. Okay, thyroid, there's a lot of women out there that have thyroid issues, Hashimoto's, things like that. And I take and I look at each individual patient and create a treatment plan that will help them create those deficiencies that they have. And it's just all about finding the root cause. It's not about saying, okay, you've got hypothyroidism, here's some medication. No, it's about finding out why your thyroid isn't working the way it should be, and finding the deficiencies that is causing that dysfunction or imbalance, and correcting those deficiencies.
Right, because there is a chance that you don't have to take the medication the rest of your
absolutely.
life. Because if you can get the nutrition and get rid of the toxicities, the body does go back to work again.
Yes, it does.
Which I think is a great approach to medications, to say, okay, temporarily we're going to control that blood pressure, but at the same time we're going to work on XYZ. So maybe down the road you will not need your blood pressure medication.
And I think that's what's really great about my abilities to prescribe if necessary, and I always tell all my patients, I'm not anti-pharma. I'm anti just throwing a pill and forgetting about it.
Which is the standard approach for the vast majority of medical care. And that's the way where I see, again, 30-some years of in my world. Again, you see that. It's like, seems like once they're on medication, all they do is keep adding more medication versus, like you said, looking for what's causing all this. Well, maybe if you exercise and stop smoking, you wouldn't need the 3 blood pressure medications.
Or stop eating at McDonald's or whatever.
I'm not against McDonald's now. Here, don't take that from me.
Oh, sorry. I should have thrown that.
I'm a big fan of the Big Mac.
I've always told my patients, primarily from day flipping one, type 2 diabetes, throwing that diagnosis out there, type 2 diabetes is a choice. It is absolutely a choice.
Lifestyle. It's your lifestyle.
All it is. And people will say, well, no, it's genetic. No, that's not the genetic piece. The genetic piece is the habits that you learn from your family.
You got it.
Has nothing to do with that.
I 100% agree. I've said that so many times.
It's a choice.
Absolutely.
Pick your hard. Actually, I had a discussion with my husband this morning about it. Pick your hard. Okay, is it harder for you to put that bread away, or is it harder for you to to get out there and exercise and eat and do what you're supposed to do?
Yeah, and probably one of the since you brought that topic up, one of the things, again, we all have these things you take away from your patients. And I had a patient, her mother was a brittle diabetic, had lost part of her leg.
Oh, sad.
To diabetes. And every time she says, I walk into Kroger, what's the first thing I walk into? Cakes, cookies. And she says, nope, I want to keep, it's at my foot or is it the cookies? And she says, I like my foot better than cookies.
Great. That's an excellent point.
But that's a mindset. What a great mindset.
It's all a mindset. It's a mindset. But that's the thing that you take into consideration or that I take into consideration with my patients is I've got to help them, educate them, and get them to the right mindset, get them the tools that they need to change that mindset. Because unfortunately, our society has been very well conditioned
exactly
to go to the convenient foods, to go to drive through. I mean, it's
easier.
Tough.
It is
tough.
easier, and
I know.
unfortunately, it's changed a little bit. But unfortunately, the fast food was always cheaper, which never made sense to me. That that organic food, which I know takes less pesticides and less, how can that be more expensive than the food that
it's processed,
et cetera, et cetera. But that is changing. And hopefully there's some other good changes going to happen here real soon.
I'm hoping. I'm very, very pleased so far.
Yep, time will tell.
So far, I'm very pleased. I was very excited when RFK Jr. was made Health and Human Services Director, and I have been following him very closely. And that's a whole nother topic. We could probably have a whole podcast on vaccines at some point. I mean, don't even get me started on that one. But there's going to be some positive changes. I truly believe there will be.
I hope he can overcome the bureaucracy. I have personally seen him speak 2 or 3 times in person.
I'm jealous.
And he's a very intelligent person. I know that the whole thing with knowing and we're around people all the time, and I'm sure you're a little bit like me. You can tell very quickly whether someone's being genuine or they're feeding you a bunch of BS. Yeah. Very, very genuine person, very brilliant. I think he had his eyes open through different situations.
Correct.
And I agree. I can't wait to see. Hopefully he can beat the bureaucracy and the billions of dollars. And we'll see. Time will tell.
It's big business. I don't know.
Absolutely. So one thing I like to ask everyone who comes in for this is like part of like what comes to mind is what is some of the biggest, or what is one of your best clients, a best testimony, like what can happen when someone goes through your services?
Easy peasy. I have a patient, an older gentleman. I think he's about 65, 66 years old.
Oh, that's also old.
Yeah. I know. Oh, did I poke the bear over there? So sorry. Sorry.
Anyway, go ahead.
Anyway, he came to me. He's a veteran, going through the VA services, just not really getting the treatment that he thought he needed. Came to me, and we just did basic labs, and I had to sit down and have a conversation with him, because his hemoglobin A1C, and the hemoglobin A1C is the marker that we use to diagnose with diabetes, type 2 diabetes. And his hemoglobin A1C was up to 9.5.
Oh.
Yeah. So I had to sit him down and have a come to reality discussion with him and say, hey, listen, you are 0.5 points away from being insulin dependent. You can still turn this around. Absolutely. And that goes back to my mantra, type 2 diabetes is a choice. You can turn this around. So we came up with a plan. I put him on a medication called metformin for a short time, and made him really hone in on his diet and his exercise. I am not kidding. In 4.5 months, he turned his A1C from a 9.5 down to a 7.2.
Wow.
At that 7.2, I took the metformin out of the picture and continued. He went on a ketogenic diet. He was out walking every day, drinking the water that he needed to drink, doing all the right things. Put him on a few supplements to help with any potential deficiencies. He got his hemoglobin A1C back down at the 6-month mark to 5.4.
Wow.
So that is my big thing. Type 2 diabetes is a choice. You have to make the right choices.
That's a game changer, because diabetics, I mean, as you know, insulin dependent diabetics, it's a nightmare.
It is a nightmare, yes.
And that's not a path.
Those were some of my sickest patients when I was a critical care nurse. Sickest patients is those that are brittle diabetics, and it's just horrible. It really is.
Yeah, and I've had brittle diabetics at the office, and I've had that discussion with them as well, hoping that they will have a better conversation with their medical doctors. And it's so sad to see that, because as you said, 99%, I would say 99.9% of type 2, they can change that. And the bigger thing that drives me wild is that it's no longer adult onset. Type 2 is no longer considered adult because you have young children.
Unfortunately, you have young children that have that problem.
And I always say it's almost criminal how they change that, but it just goes to show you how, I guess, I don't know if it's big pharma, but it's just how it gets manipulated and saying, oh, it's no longer adult onset.
They make more money off of you.
Well, and that's a big topic of discussion
It is.
because I go back to what my father always taught us. He says, your only insurance is being healthy. That's your only health insurance. And how much money is someone who's healthy worth to the medical industrial complex, right?
Nothing.
If you're taking no medication, you're not spending
You're not
any
worth
money.
a dime.
Exactly.
So sorry.
So you have to sometimes question that. What is their real, true
Right.
driving
Right.
purpose? Is it really health? It's not.
And to kind of piggyback off of what you just said about you hoping that you would have a conversation with your patients, hoping they go back to the medical provider and have that same conversation. I think one of the great things about the way I practice right now is the fact that I don't have just 10 minutes with a patient. With this patient in specific that I'm just talking about, I took an hour and a half with him, did my due diligence and research, brought the studies to him, showed him the data, showed him all of that, and it helped change his mindset. And he's like, oh, I don't have to be a victim to this type 2 diabetes. No, you don't. And one of the things I find my patients is when they claim their condition or their diagnosis, when they say, my diabetes, or I have, that's hard to get them to change their mindset,
right,
because that condition has become a part of their identity. So the fact that I can spend the time with these patients and have discussions with them and help them change their mindset and refocus what their identity is away from the diagnosis, that's game changing right there.
That's huge. And
Yeah.
what a great thing, because you're changing the trajectory of their health, but their
Right.
health is going to change the trajectory of their lives, their kids, their family. It goes full circle,
Yeah.
affects everybody around,
Yeah.
not just them.
Absolutely. Absolutely.
Well, Tina, I truly appreciate you taking today the time to come in and share what you do with us. As I said, our purpose is to bring all these pieces of that jigsaw puzzle together. And again, just thank you.
Hey, I want to say thank you. I want to take this time to publicly say thank you.
You're welcome.
Thank you, because if it was not for me being a patient of yours, and then you being my ear going, you need to do this, you need to get on your own, you need to become this, and then providing me the avenue to do that and get started, I wouldn't be where I am today. So thank you.
Well, thank you so much for that. I appreciate that.
All right.
You've been listening to Beyond the Adjustment, where we have conversations with other health-minded professionals to create a healthier community.